In today's Mind Matters, we are talking about mental health and preventing teen suicide. It's a significant concern for Ohio's youth and the second leading cause of death for Ohioans aged 10 to 14 and 20 to 34. Do you know that 20% of high school students report seriously considering suicide? So there's this program, LifeAct, this organization, they're local and they're trying to prevent teens from taking their life. And I'm happy that they're joining me here today from LifeAct. We have the program director, Anna Love, and Marcos Ortiz, one of the instructors. So glad you guys are here today. And I'm gonna start with you. LifeAct, what is it all about?
Yeah, thank you so much for having us. So LifeAct is a nonprofit out of Northeast Ohio. We provide suicide prevention and stress management programs to students in middle school, grades 5 through 12, also in high school, grades 9 through 12. So our programs are provided at no cost to schools. We want this information to be accessible to any school, any environment we go into, inner city schools, rural schools, private, public, charter. This year, we've served over 50,000 students,
Wow.
the most of any year, over 200 plus schools in 17 counties across Northeast Ohio.
Wow, that's amazing. So Marcos, you go into the schools. What are you hearing from the students and what are you doing to help them?
So absolutely, the students, when I go into a classroom, what I'm hearing more now, I've been with LifeAct for about 14 years now, so I've seen a lot in the classroom. And what I'm seeing now is that the subject of mental health is being talked about more openly by students. There is a problem though. One of the problems I see in the schools is that there's a disconnect between the students and the mental health providers in the schools. Many times I'll ask students, hey, do you know who the mental health person in this building is? And I'll have students sometimes, now there are great schools who have their mental health providers
Right.
and they know who they are, but some schools, students just kind of look around like, who is that person? So
Right.
there's a
They
disconnect.
don't know.
Right.
What are the things that's stressing them out, that's getting them to this dark side of depression and wanting to take their lives?
Well, of course, we know social media plays a huge part of that. There's a lot of negativity on social media, and so students might want to gravitate towards some negative things that they may see online because they can identify with it. But one of the things that we stress when we're in the classroom is that, feeling these symptoms of depression are not normal. But getting help is, and talking about it is normal.
Yeah,
So,
I'm glad you brought something up before we go. The social media, has there been a glamorization around suicide? Because I have a 15-year-old son and he tells me about some of the TikTok videos. Are you guys competing against that? Kids who are talking about it in that way?
Yes, definitely. So just the exposure to violence, the exposure to self-harm, that normalizes these sort of things
Right.
that are not normal. So our programs really focus on how do you get help, what is the hope in life, and how can you help yourself and your friends when recognizing those warning signs.
Wow, you're doing such a great job. I mean, you go in these schools, you even have some young people that join your board. I've met one of them, and you're just doing an excellent job because this is crucial. Our young people are seeing suicide as an option instead of talking about their problems to someone. So may you continue to do the great work that you do and save our teens' lives.
Yes.
That's what it's all about. Happy to have Anna and Marcos for getting up so early and joining us this morning. And more Mind Matters to come. I think we need to keep this going. What do you think?
let's
Definitely.
do it.
Let's keep it going.
Thank
all right,
you.
Dave, back to you.
Yeah, I agree. That was so important to hear. All right.